What's going on, everyone? Welcome to today's pandemic update for Monday, May 1st, 2023. It's the start of a new month. Hopefully April was a good month for you. Hopefully you tested negative, not positive. You stayed safe. And if it wasn't a good month, hopefully May will become a better month for you. If you are new to my channel, this is where we do our daily pandemic update. We first and foremost always talk about the coronavirus pandemic in this video, but we also talk about other health topics which are a problem, and celebrity health news or celebrity deaths and anything related to health. And we tend to always start off with India. India today added another 4,282 new cases, and they added 14 more deaths. So cases are dropping. Deaths, that was expected to be down for deaths because of weekend lag. We'll probably see deaths go up again. I don't know if they'll go back above 40 again later this week, but remember, deaths are the last number to rise in a wave because it's always cases first, hospitalizations, ICUs, and then if your case turns so severe where you pass away, deaths rise last. I think this week we'll be able to say for certain whether or not India is peaking on cases, and as of right now, the trend is towards, yes, they have peaked on cases. Let's see what happens throughout the week. I mean, I'm encouraged that their cases continue to drop. Yes, I know, they miss cases because of bad data, not enough testing, at-home test, all that business, but overall, we are also seeing less celebrity positives out of India as well. Alright, moving on to this from Nature magazine, or nature.com I should say. COVID's future mini waves rather than seasonal surges. I have so many problems with this headline. They're saying mini waves. Well, of course the waves are going to be smaller if you're not testing for the cases. And there's many of reasons for that. Testing sites have closed. People just not even bothering to get tested. Oh, it's just seasonal allergies. Oh, it's just a summer cold, a spring cold. I mean, I've heard every possible excuse. Then you have the issue with at-home tests, which we know do not get reported. Now, this article here, this story, is going to lead us into another story. It's just coincidental that they both came out, but one can definitely lead into another. There's a big problem here. We're going to read some of this article. 3 years after the start of the pandemic, SARS-CoV-2 shows no signs of settling into a seasonal pattern of spread like influenza has. That's the only thing I happen to agree with. No, this is not going to be like influenza where you have your colder season waves. No. Coronavirus is going to be something that has waves at any given point of time in the year. And eventually we're going to come into another wave. It's going to be unpredictable when we see these new waves. And I don't think it's going to be something that happens all at once around the world. It's something that we're going to see happen at various different times in different countries around the world. Someone posted on my site the other day about SARS-CoV-2, what it would look like if it becomes an endemic. And you know what? One of the things we're going to see when it's an endemic is unpredictable waves. And at any given time, we could see a new super variant. In other words, a variant that can evade immunity that causes a big wave. We're going to see some, smaller to moderate type waves, but at any given time, we could see a big wave that causes all of our resources to be stretched, such as ambulances. You may hear behind me, I don't know if you can hear or not, there's an ambulance right now, not far away. More on that in a little bit as well, because we have some startling data to show on the ambulance situation. Whether you call it a surge, a spike, wave, or perhaps just a wavelet. Now notice here they use this word wavelet. I do not like that word at all. Again, when you don't test for it, of course you're not going to find a lot of cases. And therefore they're looking for these excuses of words such as wavelet or any type of a stupid phrase to show that, hey, things are not as bad. And they come down here to say, welcome to the new normal, the wavelet era. Scientists say the explosive hospital filling COVID-19 waves are unlikely to return. I tend to disagree with that. Tell you why. They're forgetting something big here. An active COVID case is not the only thing that is causing more strain on the hospitals than we had before the coronavirus pandemic. No, no, no. You also have long COVID. As I have said many, many times, there's 150 to 200 different things that could happen with long COVID. In fact, I think we're at the point to say it's higher than that now. It just goes on and on and on. And the problem with that is some of these post-COVID, long COVID issues or complications do require hospitalization. So when you're hospitalized with a long COVID issue, it's not being counted as an active COVID case, but it is putting more strain on the hospital. It is taking up a bed, obviously, and yes, it's someone who would probably not be hospitalized before COVID came around. Now, in some instances, yes, maybe they would have been because they had a condition already present pre-COVID. But for those who were perfectly healthy pre-COVID, I always refer to Al Rucker. He had blood clots post-COVID. It caused him to be hospitalized. For people who did not have health conditions before a COVID infection and are being hospitalized, there's someone who would not be taking up a bed space. And therefore, as I'm trying to allude to here, we are using more beds than we did before the pandemic. Let's go on to our next story. Here's why that becomes a problem. Number one, it's more strain on hospitals. Number two, guess what? At the same time, read this headline. 1/3 of U.S. nurses plan to quit profession, according to a report. And it says here, 1/3 of U.S. nurses plan to quit profession. Nurses stand in a hospital doorway, and you can see, look at these nurses standing here. They just look exhausted and tired. Now, there's something this article fails to mention. Let's read the first line, and right off the bat, I think you'll figure out what it is. Reuters, almost 1/3 of nurses in the United States are considering leaving their profession after the COVID-19 pandemic left them overwhelmed and fatigued, according to a survey. So 1/3 of nurses want to leave, but it says left them fatigued and overwhelmed. Yes, of course they were overwhelmed from the volume of patients. But what else were they experiencing from such a high volume of patients? And, well, at the beginning of the pandemic, a lack of personal protection, PPE, as well. Personal protection equipment. That's right, they were testing positive. And while they were testing positive, maybe in some cases more than once, they're not superhuman. They can get long COVID as well. And some of them have gotten long COVID from testing positive over and over again. I personally know people who work in the nursing profession. In fact, one of them retired recently, has had COVID multiple times, and doesn't have long COVID, but you know what? There are many nurses who do have long COVID complications, which we know long COVID can lead to fatigue. So it's not just all about the overwhelming of patients. I mean, I get it. Yes, that can burn people out. But testing positive and getting COVID itself, that can also cause fatigue as well. And this was a fairly big survey. They surveyed 18,000 nurses. So yeah, 30% of the participants are looking to quit their career. Alrighty, switching gears here to celebrity health news. However, we will continue with the theme of long COVID in this first celebrity news report, which is from Deadline. I'm sure there were other sources, but this is the one that I was informed to. And thank you to the person who brought this to my attention. This is really important. Mike Shannon, who was an Emmy Award-winning broadcaster for the St. Louis Cardinals, has passed away. His cause of death is said to be long COVID. He was 83 years old. And we could actually click on the article, and it says here, it was complications of long COVID. It's not every day we see this, but we're starting to see it more. Remember David Crosby of Crosby, Stills, and Nash? That was reported to be long COVID, and potentially he may have had an active COVID case, a second case, at the time of his death. So we're starting to see more deaths being, contributed by long COVID and being reported on as long COVID. All right, switching gears here. Bachman Turner Overdrive. BTO, taking care of business. Unfortunately, one of the co-founders, Tim Bachman, has died at 71, and it says this is not COVID related. It says he has had brain cancer, so he was on hospice. This is sad to hear. Tim Bachman, just a wonderful musician. Rest in peace, Tim. All right, moving on to some data portions of our update for today, and we got to start off with this day in pandemic history. May 1st, 2020, FDA issues an emergency use authorization, EUA, for the use of anti-drug remdesivir for the treatment of suspected or confirmed COVID-19 in people who are hospitalized. CDC develops the PPE burn rate calculator, a spreadsheet-based model made to healthcare facility plans and optimize the use of personal protective equipment, or PPE, for the COVID-19 response. Publish it on the Apple and Android stores. For some reason, I do not remember that tool. Also, CDC launches the SARS-CoV-2 sequencing for public health, emergency response, epidemiology, and surveillance, SPEARS, a national network to provide real-time genomic sequencing data to public health response teams investigating COVID-19 cases, allowing them to track the SARS-CoV-2 virus as it evolves. And then we come down to here. As some countries discuss reopening, WHO convenes the International Health Regulation Emergency Committee for a third time and declares that the global COVID-19 pandemic remains a public health emergency of international concern. Moving on to wastewater, we don't really have much to talk about here, so we're going to skip over that for today. As you can see here, not much has updated since our update last week. And taking a look here at the transmission map, 573 counties are in high transmission, 410 are in substantial, 1,516 are in moderate, 624 are in low transmission. Taking a look here at the latest COVID variants, you can see XBB.1.5 still ahead at 68.8%, followed by the XBB.1.16 variant. Taking a look here, BNO, we have nothing to report on from them today. They haven't did the weekly update yet. New Jersey, 208 people in the hospital, 5 people in a ventilator. In the ICU, there are 19 people, and cases in New Jersey are at, for today, as it updates, 77 people have tested positive, 66 probable cases, 1 lab-confirmed death, and 2 hospital-related deaths. All right, coming over here to my city of Philadelphia. As I told you yesterday, we're going to start adding hospitalizations for this area, or EMS calls, I should say. And 692 EMS calls in the last 24 hours, meaning yesterday. That is down from Saturday's number. So 692 people had to be potentially transported to the hospital. Let's take a look at active calls that are going on in my area. This is Chester County, Pennsylvania. You can see here there's a few calls going on here. Not terribly busy. It was really busy early this morning. Montgomery County continues to be really busy right now. 36 active medical calls. That's just insanity. And let's take a look at this in a list view. And when we look at the list view, it actually shows less because some tend to stay on the map for a while. And you can see here, general weakness, cardiac emergency, general weakness, hemorrhaging, that's not good. General weakness, cardiac emergency, cardiac. There are a lot of cardiac emergencies as of lately, and we do know that can happen post-COVID. And I think it's safe to say there's been a huge increase in calls like that since the pandemic started. All right, Center County, Pennsylvania, the only hospital in Center County, Pennsylvania. Just 5 people in hospital today. They've been bouncing back and forth on that number for the past couple days. All right, ending on New York State today. We're not doing the international pandemic update in this video because we're going to do a separate video for that later on. There's some new data that I found in the international update for today. All right, 281 cases in New York State in the last 24 hours, 1.6% positivity today. 7-day average is 1.4%. Hospitalizations for the time being are level in New York State. This is some good news. 617 people hospitalized, 63 people in the ICU. Alrighty, that does it for today's pandemic update in the United States. We're going to do an international update later on pertaining to XBB.1.16, so stay tuned for that sometime this evening. I thank you for watching this video. If you like it, give it a thumbs up. If you want to see more like this, hit the subscribe button down below. I'll see you all again next time. Until I see you again next time, stay safe, everyone.